A warm good evening. Today we are going to discuss about smell bell verbal cephalocervical surgical causes, and that is understanding of ENT. Today we are discussing about the herpes zoster urticus, which is a very important disease and very common disease, as you can see in the practice. This herpes zoster urticus is defined as a vesicular herpetic rash upon the concha or the pinna region or external auditory canal or associated with the lower motor neuron type of facial palsy on the ipsilateral side. This is also called as Ramsay-Hunt syndrome, as Ramsay has given a description of this Ramsay-Hunt syndrome, wherein there are three types of Ramsay-Hunt syndrome. This type 1 is associated with facial paralysis. Type 1 is associated with facial paralysis, and the other two types are having generalized manifestation as told by Ramsay. Talking about the pathology, wherein which you could find the viral particles in the spiral ganglia of the cochlea. As you could see, this spiral ganglia of the cochlea. This is the spiral ganglia of the cochlea, wherein within the cochlea it will be the spiral ganglia within the inner ear, or the vestibular ganglia, Scarpa's ganglia in the vestibular system. Scarpa's ganglia in the vestibular system, as you could see in the explanation as possible. And the reactivation of these things leads to the formation of vesicles because of the previous herpes zoster infection in the childhood. These viruses are seen in most of the patients with these things with vesicles. 100% of the patients will have viruses, as you can see. Based on the diagnosis is a clinical finding where you can have herpetic vesicular eruptions, wherein you can definitely see. But as far as the MRI is concerned, once you are going to take an MRI, if there is any lesion inside with a viral inflammation, it seems to be like a schwannoma, as you can see. So it's very difficult to differentiate. So MRI is not at all required. It is the need of the day that you need to have a description of a new test which can just describe this and then make the diagnosis possible. Yet cheap and available test is not available except for the PCR that is available for viral marker. Eighth nerve, that is a cochlear nerve, can be involved. Like this eighth cranial nerve can be involved. If it's a cochlear part is involved, there can be a hearing loss as far as the hearing part is concerned, and a balance problem as far as this one is concerned, and the tinnitus can be there because of the cochlear part is concerned. And you can see that this virus can reside at any place, like by means of this cochlea till the level of the brainstem in the auditory pathway. Anywhere it can be there. The most important complaint that the patient has is that is the ear pain. The auricular pain is the most common presenting complaint. It need not be there in all the patients, and in some patients there can be rash. And 40% of the patient, 14% of the patients need not complain of this rash. Rash is not a compulsory thing for this herpes zoster urticus. This rash can be present not in the ear or external auditory canal. It can be present sometimes within the oral cavity of the pharynx, which can be a diagnostic sometimes. Even before the rash, there can be some hearing loss and tinnitus. It can be there. And the spreading of the infection is from vasa nervosum, from one nerve to one nerve, and even to the level of brainstem, as already described. Vasa nervosum, it spreads from facial nerve to the cochlear nerve, as it is like. And by the way, it can spread to the skull base itself, involving the multiple cranial nerves. There is one more condition called as zoster cyni herpeti. Zoster cyni herpeti, wherein facial paralysis can be present even without a rash. Facial paralysis can be present even without a rash. Facial paralysis can be present even without a rash. Zoster cyni herpeti, wherein you can find zoster DNA from this PCR, from these vesicles, as you can see. And if you take in children, 20 out of 100 facial paralysis unilateral in children are due to herpes zoster urticus, and it is the second most commonest cause. Second most commonest cause after this particular Bell's palsy is concerned. Second most commonest cause of facial paralysis in children is herpes zoster urticus. And as far as the outcome is concerned, if you take earliest treatment, if a House Brackman grade 1 facial paralysis, almost 50% of the adults definitely recover from this, and 80% of the children recover from this. And in untreated patients, more than 60 out of 100 patients they develop facial paralysis within a week. Within a week, 60 out of 100 patients develop facial paralysis. It's a must as a rule. So if facial paralysis is complete, only 10% of the patients among the facial paralysis recover normally. If after 10 days there is some amount of neural function, only 10% recover. So we have to be very careful. Only 10% recovery of facial paralysis after 10 days. If the facial paralysis is complete, if you are not treating well. Even there is recovery, there is a chance of residual synchronicity that has to be kept in mind. Treatment includes the best is AP regimen, that is acyclovir, which is an antiviral drug, which is 800 mg per 5 days duration, and then prednisolone, which is a steroid, and which has to be given 1 milligram per kg per day. It should be started within the 3 days. Within the first 3 days, it gives the best result. First 3 days, it gives the best result. Only 30% are expected to get good result if it is started beyond the day 8. It's better to start within the first 3 days. And there is no difference between IV acyclovir and regular acyclovir. And if the treatment has to be given, it's to be given as early as possible, because of acyclovir, the post-herpetic pain, post-herpetic neuralgia will be a bit lesser than as supposed to be. And it is a cheaper version also, that you are getting more relief from the facial paralysis if you use acyclovir. Acyclovir is a must here. It's better to use this one. To wind up the proceedings about this herpes zoster urticus, the facial paralysis is more common as supposed to be than before. Second thing is, it is involving the other nerves by means of vasa nervosum. Third thing is zoster cyni herpeti, wherein the rash is not there but facial paralysis is there. You have to think about it. And fourth thing is acyclovir, prednisolone gives good results, and early treatment gives good results of this. And development of a very good investigation is yet lagging in this field. And now this is Dr. Smell Bell, verbal cephalocervical surgical from India, signing off. If you like this video, kindly subscribe and share for a better understanding of ENT and head and neck. Thank you very much.